everybody knows us. Steve, thank you for coming out and speaking with us today. Steve is a member of the College of Kinesiologists of Ontario. He's also an Ontario Kinesiology Association board member and is a past member of the Canadian Kinesiology Alliance. Has been working in the field for years and is a researcher at the University of Waterloo, which is one of the top universities for kinesiology in the country. So Steve, I'm not going to go over the bio too much, but welcome, and I'll let you speak from here.
Great, thanks for the introduction, Daryl. Good morning, everyone. Really excited, happy to be here with you today for the Professional Development Day, and excited to talk to you a little bit about job matching, artificial intelligence, and wearable sensors. Today, I'm going to talk a little bit about some of the research that we're doing and some of the research that's going on more broadly across North America and Europe that relates to functional capacity evaluation and physical demands analysis. So the two kind of components or assessment components that might go into job matching for returning individuals early and safely to work. It's been an exciting area to be involved in as a researcher, especially over the last kind of 3 to 5 years, as we've seen some rapid advances in both technology and in math, effectively, so artificial intelligence, machine learning. So there's lots of things happening. The field is moving very quickly, and it's my hope today that I can give you some background for those that aren't as familiar. I give you some context, some background to start to be aware of where things seem to be headed in the future. Some of you may be working with emerging technologies already, and that's wonderful. But for those that aren't, I hope that you'll come away with this with a little more awareness. Maybe that will entice you to reach out and see if you can embrace some of the emerging technologies, or at least at a minimum, you'll know kind of what questions to ask and a little bit of the lingo to help you sort through these things as you're making decisions about updating, adapting protocols moving forward, or embracing some of these new techniques. As we get started today, I do have the chat open, and I hope you don't mind. I have kind of one screen with the slideshow, one screen with my camera. So if it looks like my head's looking away, it's just because I'm kind of keeping track of the slides and where we are. So please don't be alarmed by that. If there are questions, I believe if Chris or Daryl or George could chime in just quickly. The chat is live and open, correct?
Yep, chat is live and open, and it's also being recorded, the screen sharing and the chat.
Perfect. So if you do have questions, feel free to type them in the chat, and I'm happy to kind of pause as we move through the talk. There'll also be a little bit of time at the end for some Q&A and discussion. So again, thank you for the opportunity to be here today and to share some of our work with you. Really excited to talk about where we see the future going in physical demands analysis and functional capacity evaluations. So in terms of learning objectives, I've kind of summarized these briefly. Really 3 goals that I have for today. I hope that by the end of this session, you'll be able to walk away and you'll be able to explain what terms like wearable sensors and artificial intelligence mean in the context of return to work. Some of you may already know this coming in, but hopefully we'll level the table, level the playing field for everyone and make sure we're all on the same footing in terms of understanding some background and lingo here. I'll spend a little bit of time talking about some of the work where we've been exploring new ideas about how we can leverage emerging technologies to enhance physical demands analysis and functional capacity evaluation. So my hope is that at the end of this, you'll be able to describe what the future state could look like. And in some clinics, I know we're starting to see that move happen quite rapidly. Lastly, within the context of technology, emerging technologies, it's my hope that I can leave you with kind of 4 tips that I hope might be useful to you to stay on top of the rapid evolution as things change in the field here. So I have a couple tips and tricks that you can use to sort of reflect on your own practices, think about what you're doing. And it may not be changing your practices, but kind of foreshadowing here a little bit, just thinking about the data you're collecting and how you're managing that data and how you could potentially use that data in other forums to start learning kind of more systematically from that data to enhance the quality of care that you can provide for your clients through these assessments. So again, really excited to chat about that as well as we get into the tail end of the talk. So what I want to do with respect to the first learning objective is just make sure we're all on the same playing field here. And I'm going to introduce a few terms. So the first is artificial intelligence. And I'm sure we've all heard AI. I hear these two words everywhere. It's even at the grocery store, I hear people talking about AI in the lines at the grocery store. I'm not sure we all have a good sense of what it means, but we're certainly talking about it. For the purpose of our discussion, you'll see the definition on the screen here. It's effectively, we're just using the computer to mimic problem solving and decision-making capabilities. So we don't have to think of this as some magical tool. We have these wonderful computers, and if we give them the right structures, the right algorithms, they're quite clever and adept at making inferences, at identifying patterns, at solving complex problems that in some cases, we struggle to solve on our own. So a really powerful branch of that is machine learning. And I'm sure, again, many of you are maybe familiar with the topic of machine learning. Some may be even exploring some simple machine learning tools. But it's the branch of AI that focuses on the use of data and algorithms to imitate the way that humans learn, and we gradually can improve sort of the ability of these machines to learn. The key here is that all of these machine learning algorithms are typically trying to learn to identify features, to classify, and to predict. The simplest example I can give you of a machine learning algorithm, if you all think back to high school math, and we would have learned the equation of a line, y equals mx plus b, where m is the slope and b is the y-intercept. So if we kind of think of that line function. Now, if you think back to maybe your undergrad statistics courses, and we would have talked about correlation, and we would have had a little graph and a little point cloud of dots, and we would have fit a line through those dots, a line of best fit, and that line, by finding that line of best fit, we would solve for y equals mx plus b. That is kind of in its simplest essence, a machine learning algorithm. That algorithm is learning the relationship between x and y based on the spread of those data. So hopefully you can kind of picture that in your head. So things like linear regression are very simple forms of machine learning in some regard. So from that perspective, we've actually had machine learning for a long time. We just may not have had as much development in that space. But the key takeaway message here is that machine learning is really about training a computer to identify, to classify, or to predict outcomes. Now you can imagine as we dive into physical demands analysis, a lot of time, what are we trying to do? We're trying to identify tasks. We're trying to classify. What are we doing in an FCE? Well, we're trying to predict ability in some regard. We're trying to classify folks based on their level of performance. So as we get through the talk today, hopefully you'll see why some of these tools can be really effective in terms of enhancing our ability to conduct physical demands analysis, or PDAs, or I might call them PDDs, physical demands descriptions, as we move through the talk, or functional capacity evaluations as well. Now, digging a little deeper, you may have heard the term neural network, and that's, again, within the branch of machine learning. And artificial neural networks are really a subset. And depending on the complexity of the neural network, we refer to them as deep neural networks or deep learning. Lots of, again, kind of buzzwords and jargon. But effectively, it's, I'm gonna simplify this quite a lot here, but if we think of that sort of linear regression or just simple regression equation that we hopefully are all familiar with from our undergrad statistics classes, neural networks are effectively a big fancy regression equation. Again, I'm oversimplifying here a little bit, but conceptually, we have inputs and we have outputs, and there's some relationship between them. So exactly like we would in a correlation, just kind of the way we understand the relationship between the inputs and outputs is a little bit more complex than a simple regression. But again, really powerful tools. So if we have some known inputs and we want to predict a particular type of outcome like workability, a neural network can be a really effective tool if we have the right types of inputs. So again, I'll talk a little bit more about this later, but one of the things we're doing is when we're testing folks in the lab, and we're running them through a battery of functional tests, do we need all of those tests? Do we need some of those tests? Are some of those tests equally as predictive as having all of those tests if we give the data to the machine and let it figure out the relationships and predict outcomes? So really interesting opportunity right now, I think, in the FCE space to ask some of these questions. What should we be testing? How often do we have to test it? Do we need to test, do I need to test all of these facets? Or can I predict outcomes based on a subset, and I can really, reduce maybe the amount of time I need to do an assessment and perhaps open up the time or budget envelope for more time treating my client. And lastly, the other term I just want to introduce today is computer vision. And the branch of computer vision that we're talking about is kind of related to neural networks. But basically having the computer identify objects on the screen. And then in some cases, as you'll see, we can start to identify even specific joints. And suddenly, with my smartphone here and my video camera and computer vision, I suddenly have a biomechanics lab in my pocket. Now, we're obviously not quite there today in terms of accuracy, but we're remarkably close. So that's, again, I'll kind of talk a little bit about that as we move forward today. The last topic I just wanted to introduce before we dive into the research and give some context here is wearable sensors. This probably doesn't need a lot of definitions. I'm sure every one of you can look down at your left or right hand, possibly at a ring, and you probably are wearing some form of wearable sensor right now, whether it's an Apple Watch or a Fitbit or a Garmin or an Oura ring or whatever it might be. And it's been fascinating to see the evolution of this. And I know many of us in kinesiology are probably very closely watching the types of insights and types of information that folks are able to generate about themselves. But effectively, wearable sensors are just small electronic sensors that measure something that can be worn on the body. Common wearable sensors that we're probably most familiar with, again, might be heart rate. If anyone's using some of the smart shirt technologies, maybe breathing rate. Many of us are using some form of GPS tracking, some form of step tracker, which might be related to an accelerometer. In some cases, as you can see on the screen here, the little IMU on the back. So we'll talk a little bit later. Many of you might have been exposed to technologies where you ask the client to wear a little monitor on their back and we get spine inclination angles and things like that. So again, we'll chat more about those, but it's these tools that are starting to come together, the mass accessibility of reasonably qualified smart electronic devices, combined with the power of these emerging mathematical tools and computer hardware that has the capability to run these analyses, is really creating an interesting kind of interesting storm that I think is going to cause us to see a fairly rapid advance in the near future in terms of how we perform some of our job matching functions. So again, just making sure we're all on the same page, current state, functional capacity evaluation, and physical demands analysis. Again, this is probably a review for many of you, but for those that don't practice in this area of kinesiology, I just wanted to kind of set the tone here. And the way I'm going to kind of come at this is from the perspective of the wellness wheel. So there's a few companies that we've had a chance to interact with: BrainFX, Highmark Interactive, Metrics, and Work Wellness. They've been spending a lot of time thinking about, what does wellness look like in the workplace? And they've kind of conceived it as this wellness wheel. So I'm going to use this wellness wheel to position job matching and position functional capacity evaluation and physical demands analysis within the wellness wheel. So if we think broadly again about workplace wellness, we are really focusing on, that individual is missing work, there's a treatment plan, and we're trying to get them reintegrated. We're preparing them to get back into work. Now, this is beyond the scope of our discussion today, but ultimately we want to get them back at work. We want to keep them at work. We want to identify and be preventative in terms of catching potential problems before they arise so that we can help them stay at work. But again, in some cases, folks get injured and then we're sort of back in this wheel. Now, within this, there's a variety of healthcare services, many of which are driven by kinesiologists across the country. And as I'm talking about today, digital health technology is starting to play a really important role in all facets of practice that are related to workplace wellness. But what we're really focused on today is how digital health technologies are emerging in the functional abilities assessment or functional capacity evaluation area and the job demands analysis or physical demands analysis space. There's lots of exciting digital health technologies kind of throughout the continuum of workplace health. If you're ever interested, happy to have a conversation, feel free to reach out and we can have a virtual coffee, virtual chat and talk a little bit more about these areas. But for today, we're going to focus down here. We're trying to get folks back to work. We're doing an assessment of their capabilities. We're understanding the demands of their job. And we want to make sure we get those folks reintegrated as early as possible and as safely as possible back to the workplace. So again, this is more kind of just make sure we're all on the same page. When I say job matching, what do I mean? Well, again, we're just matching functional abilities with physical demands. I really like this diagram from a paper quite a while ago, but it's quite simplistic. We assess the worker, or in some cases, population capacity. We assess the demands of the job. If we don't have enough information, we go back and get more. Generally, we will with a good FCE and a good PDD. And then is there a match? So do the capacities at least match or exceed the demands? If they don't, we really have two options here. One, we can try to increase the capacity. Work hardening, obviously, is something many of us are doing in practice, or in some cases, again, speaking about digital health technologies and emerging technologies, we won't spend a lot of time on this today, but things like exoskeletons, augmentation devices can be used to augment somebody's capacity to meet demands. Or kind of true blue ergonomics, we want to fit the task to the worker. So using things like the hierarchy of controls, we can also adjust job demands appropriately, either eliminating extremely physically demanding tasks, engineering out risk or engineering out some difficulty where possible, or in some cases using administrative controls like job coaching are all effective to help us get this match. So in terms, again, of PDDs, many of us are familiar. If you're not familiar with physical demands analysis, some really great resources. This was developed by the Occupational Health Clinics for Ontario Workers. There may be similar resources in BC as well, but this is free. I think you have the link. The link will be posted with the slides, or we can post this afterwards in the chat if it would be helpful. But really useful resource, and basically breaks the PDD down into 3 phases. Understanding where and when you need to do the PDD, capturing the information with as highest accuracy as possible, and then reporting. But again, as many of us are probably familiar, what we're doing is just observing work. And like I mentioned before when I was talking about the machine learning techniques, we are trying to identify tasks, and we're in some cases trying to classify tasks. And the other piece to this is we're often trying to measure whether it's forces or loads or those types of things. So that presents an interesting problem, and I want to highlight that because we'll come back to that a little bit later. So again, remember the PDD, if we really break it down, is just identification, classification. These are all things that are possible with tools like computer vision and machine learning. Again, just kind of setting the stage on the FCE side. And I'm going to expand this actually. This could be a functional capacity evaluation, but the same premise approach typically applies if you're doing some sort of physical employment standard, which are much more common in first responder communities, or maybe something referred to as a POET, post-offer employment testing. So any sort of capacity testing that's designed to enhance the fit with an individual to a workplace. I think broadly we're talking about all of these topics, but today we're using the term functional capacity evaluation in the context of return to work. And again, just so we're all on the same page, the best practice document. And for those that haven't had a chance to read it, you'll just see a link here on the bottom of the screen. Steve Allison and colleagues published a really nice document in 2018 on current concepts in functional capacity evaluation. So I know Steve and his team spent quite a bit of time on that. So if you haven't seen it, do dive into that resource. It's really quite helpful. But again, what are we doing? We're reviewing some medical history. We're reviewing the referral. We're probably doing some screening around psychosocial or pain or functional questionnaires, kinesiophobia, that sort of thing. We might do some sort of MSK, just a basic kind of postural assessment. And then we'll move into some form of physical testing, maybe manual materials handling, postural tolerance, coordination, and the like. But again, think, what are we trying to do with all of this information? Well, we're probably trying to inform a treatment plan. So what we learn from this sort of battery of information can be helpful to shape the treatment plan. If we really simplify it, is the intervention with this client going to be more mechanical? And what I mean by mechanical is, we're really focused on, let's say, strengthening or lengthening, those types of things. We're changing the mechanical function of the body. Or is there a psychological element? Is there, a fear of re-injury that we really maybe perhaps need to work collaboratively with other colleagues to help address those elements to really get that effective transfer back to work. But again, we're trying to identify and classify. So identify the parameters that we need to address, classify that individual in terms of the types of treatment they might need, predict workability. So again, they lend themselves really nicely, I think, to some of the tools that are available as we continue to grow access to things like wearable sensors and machine learning technologies. So all of that background, I'm just going to pause for just a moment. I noticed there was a comment there around the psychosocial pieces so often missed, and I'm not going to do that justice today. I'm not going to spend near enough time there, but I wholeheartedly agree that psychosocial piece is really critical. And I will talk a little bit about how we're trying to untangle that. Any other questions now that hopefully we're kind of all on the same stage in terms of machine learning, AI, wearable sensors, what a PDD is, what an FCE is? I don't see any questions coming in, so we'll continue forward here. So where could the FCE field go? And here's where I want to talk about some of the emerging research, the bleeding edge of the knife, if you will, around some of the things that our lab's trying and other labs are trying to help address some of the emerging challenges in the FCE space. So we had the opportunity to work through the CKA, this was back a few years ago, about 5 years ago now, where we surveyed kinesiologists about their functional abilities practices. And one of the questions we asked was around MMH testing, manual materials handling testing, lifting, lowering, pushing, carrying, pulling, and the like. And one of the questions that came up is, well, how do you know when somebody's reached their capability? Do you just let them tell you? What do you do? And that we've learned some really interesting things there. So again, all I'm listing here across the row vector is just different types of manual materials actions that you might test in a clinic. And then what criteria were kinesiologists using as endpoints? Biomechanical observations, just kind of watching for folks, changing maybe their balance, changing their leaning, muscle bulging, that sort of thing. Maybe there was a preset criteria. So as soon as the client could reach X amount of weight, that stopped the test. Physiological signs. So in some cases, folks were monitoring things like heart rate. And if heart rate exceeded a particular magnitude, the test would be stopped. Oftentimes, this is more used in safety, I think, than in actually determining the limit. Volitional failure. So the participant just stops. Sorry, not failure, volitional endpoint. And then in some cases, a psychophysical scale, maybe a rating of perceived exertion. So what we learned, and what you see here, is the percentage of respondents that tended to use a particular criteria. So if I just focus on the low lift column here for a moment, what you'll see is that basically 2 in every 5 kinesiologists are making decisions based on what they see. So again, might be monitoring for changes in weight shifts, might be monitoring for excessive leaning as you're trying to really kind of get a heavier load up onto a shelf, for example, maybe really looking for muscle bulging, that sort of thing. But for 2 out of 5 of these assessments, effectively it's you and I are watching this individual and making a decision. And that's great for the most part. But what if we don't all see movement the same way? And what's really interesting is if we start to dive into the research here, folks like, or considerations like training. So how well trained I am to sort of see movement can make a big impact on my ability to correctly observe some of these behaviors. So my experience level might be a huge factor. The clothing that the client wears can be a huge factor as well. And obviously, we try to get folks to wear, sporty clothing, kind of tight-fitting clothing where possible. But there's a number of unconscious biases as well. And there's a lot of research that shows, the size and shape of the client, the way the client acts, can have an implicit bias in how you observe those movements. So, if we think about the importance of biomechanical evaluation and the risks that, maybe I'm having a bad day and I'm making decisions and I'm saying this person can do more than they can or less than they can, and that's really making a poor fit down the line in terms of the return to work, that's a potential problem. But this, again, one of the opportunities in AI. So if you remember, we talked a little bit about computer vision. Well, a question that often comes up: are our eyes better than a computer? So what if we weren't relying on my eyes or your eyes? What if we let, my smartphone? What if we let my smartphone video? What if it's the observer? What if it makes the decision? So we're spending a lot of time in our lab right now working on a technology called pose estimation. So what you see in the video here, this is just a 2D video. You can record it with your smartphone. And then we run that video through a deep learning, a computer vision algorithm, and it basically projects, joint centers onto the body. And as you watch the video, you can see there's a little bit of jitter and a little bit of movement. It's not perfect. You can see that it's trying to predict the 3D locations of all of these joints. That's not easy to do when you have only a 2D camera. So these solutions are not yet perfect, but they're growing. One of the barriers to entry right now is to access this technology does require, in many cases, some ability to code. So that's created a barrier that a lot of folks don't have access to this yet. But the technology is moving quickly. This particular company, Wrench AI, had created a pose estimation that didn't require us to code, which was fantastic. We could start exploring. But about 6 months ago, they got purchased by Hinge Health. And if those of you that are familiar with Hinge Health, it's a large kind of Silicon Valley company really focused on being a leader in digital healthcare. So the space is moving so quickly that, as technology comes out, it's getting purchased up, and it's been a bit of an adventure, but definitely an interesting opportunity moving forward. So we've spent a little bit of time in our lab kind of trying to sort this out. Well, what if we can start using pose estimation so we can lessen the need to rely on my own eyes and my own conscious or unconscious biases? Can I remove some of that by using the computer? Now, let's assume for a moment that we can. Let's assume we can use my smartphone and we can record video and we can have the computer see the movement. How does the computer know to classify it? So we've spent a lot of time here, again, using machine learning, and this is really about awareness to give you some insight here. But one of the things we can do is we can look at patterns. So in the top right, each of these dots actually represents a lift. So we were able to boil a lift down to sort of a series of representative, I'm going to call them features. So for in your mind, you could think of a feature being a combination of spine angle, knee bend, and eye line or something. Now in this case, there's a little bit kind of going on in the background, but basically we define a lift on a series of features or a series of characteristics that can identify what that lift is. And in this particular case, if we have people do a bunch of lifts, we can sort of draw a boundary around that. What does normal look like? Well, here's kind of what normal looks like. Now, what if we have them lift for a long time and fatigue them? Well, suddenly those lifts don't fall in that boundary. They're doing something differently. So by using these types of machine learning approaches, we let the data decide, well, what's normal, what's not normal, and how likely is it that a particular lift is not normal? So where we're going here is around pattern recognition and classification. What you see in the video is the computer identifying lifting patterns. So we had about 30 folks in the lab performing some lifting tasks. This was a lift right from the ground floor, as you can see here. And we recorded everybody lifting. And then we gave that, again, I'm simplifying here, kind of gave that data to the computer and said, using some particular algorithms, we said, are there patterns? Do people cluster? And what we really wanted to know is, we can do a biomechanical analysis in the lab. And some folks experience high forces on their spine when they lift, and some folks experience lower forces on their spine when they lift. They lift with a safer strategy. Can we give you that data, computer, and let you figure that out? So what you see on the screen here is exactly that, where the black represents lifters that lifted with low biomechanical exposure relative to the red lifters. And what you quickly notice here, if you kind of using your biomechanical lens, is that the black stick figure is more forward. Some people chose just to get closer to the load naturally. And we all know that if we can get closer to the load, we can keep the moments lower. You also notice that the timing is a little bit different. You probably notice that the knee bend is a little bit different. So again, these are all characteristics we could probably see, we can probably be trained to see. But the computer figured this out in about 3 minutes. And now that the computer knows what to look for, we can just use this going forward. So I can record that data in my video camera, run it in through the computer, and the computer basically tells me, are you more like the black stick figure, or are you more like the red stick figure? We're working to figure out, where do you draw that line? At what point do you sort of say, you're getting to a point that's biomechanically unsafe? But this is sort of some of the formative work that's happening in the space to help get to a point where we can almost automate some of the decision criteria here within an FCE context. So here was another an example. Again, can the computer identify features that our eyes may miss? So we tested folks doing the EPIC lift protocol. So for those of you in the FCE space, many of you may be already using an EPIC protocol or derivatives of it. And we had people performing these lifts. And again, we have kind of let the computer sort this out. And it identified kind of the black stick figure here is the safer lifters, and the red were the unsafe lifters. And for those of you that do the EPIC test, you would know there's usually a series of criteria in terms of observational requirements. So there's certain characteristics that you're looking for. And what the computer told us when it identified what differentiates somebody that's lifting safely from not safely, for example, there were other characteristics to consider. So again, without going into a lot of detail, I'll just highlight a few of these. So the computer helped us really easily identify foot position really matters. Some people get, again, closer to the load. Hip position, which corresponds to knee bend, and in some cases spine bend, which we don't see well in these particular renderings, can really be important. And again, the computer was able to tease out these patterns. And intuitively, makes perfect sense from a kinesiology lens that, the folks that can sort of avoid that the excessive curvature through the spine and really rounding through the spine, and the folks that can sort of maintain that neutral spine as they perform the lift, they're going to have a lot less exposure on the spine. When we look at the upper body positioning, for example, so again, if I pause for a second and think about this, if I'm watching somebody do a lift, and maybe there's folks on the call that have a lot more experience than I tend to narrow my focus. So I tend to focus quite intently on maybe a particular area in the body. Sometimes I can do more than one, but I struggle personally to try to watch and observe a variety of different behaviors. So I might be really attentive to watching the upper limbs, and then my ability to monitor the lower limbs is a little bit less if I'm kind of being honest with myself. But what's nice about this is the computer can see all of it at once. So my bias might be to focus on kind of the hips and the lumbar spine, at the risk of not knowing maybe how close the feet were, or maybe not knowing if they were leaning the body over to try to reach the load out to the shelf or whatever it might be. So again, just highlighting and see here, some folks really were able to get their entire upper body close to the shelf, keeping the load close. others really extended the arms out in front of them to place that box out. So the phenomena we're seeing humans do, we're all used to seeing these things in clinic when we're running assessments. What's really interesting here, though, I think, is that in 2 minutes, the computer can do exactly what we can do, maybe better. We can argue that for a different day, but we're getting quite close in the ability to use these tools to identify and recognize patterns that can help us make decisions about, for example, stopping criteria in MMH tests during FCEs. This was just another kind of quick example. In this particular study, we didn't tell the computer anything about whether somebody was experiencing high or low loads in the spine. We just said, here's a bunch of people doing tasks. Do you see natural occurring patterns? Now, this happened to be the functional movement screen. So I'm deviating a little bit from kind of a classic FCE, but still just generally kind of on movement assessment. And they're subtle here, but the computer picked out 3 unique patterns. So of the 40 people that we looked at, typically they fell into one of 3 patterns. And it's not always black and white. I'm not always pattern 1 or always pattern 2. But we can use what are called unsupervised machine learning techniques to, we don't tell it what to do. We need to let it find patterns naturally. And it found these 3 patterns. Now, not surprisingly, all of these individuals are trying to do a hurdle step task. They're trying to step up and over a hurdle with 1 foot while they're holding a beam kind of across the back of their neck, back of their shoulders. Now, they're all doing the same task. So it's not perhaps surprising that the 3 stick figures here that are shown in blue, red, and black all effectively look the same. But there are some unique characteristics that differentiate them, and they differentiate at different phases in the movement. And again, this is something that oftentimes as a performance coach or as a kinesiologist, it's not always easy to see all of these phenomena at the same time. But for example here, the red stick figure, folks that seem to have those types of movement habits, movement behaviors, they had a lot more knee flexion as they were going over the hurdle. Perhaps that's because they don't have enough hip flexion. I don't know. We didn't look at sort of root causes here, but we certainly could pick out patterns. There's some patterns in how people shift their body weight, for example, both in the front back direction, but also in the medial lateral or left side to right side direction. So again, I show this just to highlight some of the possibilities that are emerging and the potential benefit of allowing the computer to play a little bit more of a role in terms of identifying, classifying, and in some cases predicting in the context of FCE outcomes. So this one was our most recent study, and what we were interested in is, can the computer tell us when somebody's tired, when they're fatigued? So can the computer see what fatigue looks like? And so again, just like I spoke of earlier, if we look down to the left, we had people do a number of lifts so we could help the computer understand what normal is. And then we continued to have those people lift for up to 60 minutes. Some people stopped early. So some people, got tired and said, I'm not lifting anymore. I'm not going the whole hour. I just want to get out of here. Some people went the whole hour, but reported an RPE value that had climbed steadily throughout the test. So they were likely fatigued, maybe not to end point. But then we had other folks that had no problem and they could lift the load for a full hour. Now, these were healthy individuals. This wasn't in an FCE context, but it was using a floor to waist height lift that would be typical of a low lift MMH task in an FCE, for example. And what we see here is along the x-axis is time. So as they're doing lifts, more time lapses, they continue to do more lifts. What you see on the y-axis is the number of lifts that were falling outside of the boundary. So it says they're no longer normal. And what we see with the folks that fatigue quickly is a really nice pattern here. So, as they continue to lift, fewer and fewer lifts fell inside the boundary. So in almost all cases, by the time they were fatigued, 100% of their lifts were outside of the boundary. Now, as a decision-making criteria, that helps me to know that if I'm not monitoring RPE, for example, the computer is telling me, in this set of 10 lifts, 5 lifts looked like normal, 5 lifts didn't. Oh, in the next set of 10 lifts, 3 lifts looked like normal, 7 didn't. And then the next set of 10 lifts, all 10, they don't look like normal. So the computer is kind of learning how the patterns are changing. And in this case, we can show that those patterns are synonymous with fatigue. Now, what was really interesting about this is we used an approach that was subject specific. So we didn't assume we knew how people would change, and we didn't assume people would all change the same way. We're all a little bit different. So this method, we created kind of each one of these little diagrams, as you see in the bottom left here. We created one of those for each individual lifter. So it's a very subject specific approach. There's a number of, there's actually a group out of Calgary, University of Calgary right now that's doing some interesting work with inertial motion units and long distance runners, and trying to use the exact same approach to identify when a runner is fatiguing, to identify when a runner might be likely to get injured, which again, if a run looks like different from maybe previous runs in terms of the mechanics, that might be predictive. So really interesting. But if you look at the folks that were sort of fatiguing, some of them reached kind of 100% outliers, which said their pattern had completely changed from baseline. Others had not. So can the computer see when we fatigue? Sort of. It's kind of a cool idea, but we're not there yet. And one of the take-home messages I have for everyone today is I'm obviously really excited by the possibilities in some of these technologies. But as we're moving forward, they don't always work perfectly yet. So be a little bit skeptical, be optimistic, be hopeful, but continue to be skeptical and ask good questions to understand what the technology is doing. So Alfred just asked in the Q&A there, what analysis system are you using? Do the people have markers on? Yes, Alfred, for this particular study, we were not using just a simple smartphone. We actually had folks marker up in a lab using a Vicon motion capture system because we knew that marker data would be a little bit more accurate. We've also done this with inertial motion units, so IMUs. So we can place those little IMUs on the body, and we can do something very similar with a similar level of both success and failure. So we're still working on that a little bit. Thanks for your question. So one of the questions, and this kind of stems from Alfred's question, so it's a nice transition point here. What if I don't have all of this marker kind of get up in the lab and I just rely on pose estimation? So I just rely on my smartphone and computer vision. So we had a chance to do this as folks were doing some functional capacity evaluation tasks, and we learned a few things. So we learned that, whatever I'm using my smartphone for, this pose estimation, it has to be trained on some data. And it's most likely trained on data from the acronym is the COCO data set. And the COCO data set is basically a bunch of pictures where somebody digitized all the landmarks, but the actions might not have anything to do with lifting. So they don't generalize well. So we learned that moving forward, we probably want to do a much better job in the kinesiology community of making sure that we have data to train these models that are relevant to the movements that we would see. So if you are in a position to talk with a vendor or something and they're trying to pitch, pose estimation or computer vision, or they're trying to sort of pitch these things, one of the questions that you want to ask them is, well, what data or what movements is your system trained to really be able to see? Because the computer just doesn't see everything. It needs to be trained. It needs to be trained very deliberately. And we learned that it's really important that we train it based on data that's relevant to kinesiologists. Currently, most of these are pretty good at predicting 2D, not so good at 3D. That's a work in progress. The perspective is really important. So the camera angle that you use is really important. And ideally, as we move into the clinic, will be really important that you're always using the same camera angles. If you're recording FCE sessions now, whether it's just a camcorder or whatever, just even for litigation reasons, if you are doing that, always good practice to standardize where that camera is relative to where your actor is or your client is in the space. And that data might actually be more powerful than you know. So again, if you have a chance to video record these, I certainly encourage it, and make sure that you're standardizing so you're always viewing from the same angles. The other challenge we have is frame rate. So anytime you are videotaping, if you have the opportunity to have a higher frame rate, by default, most of our phones, most of our camcorders are about 30 hertz, but they do have settings that allow you to increase that, especially with some of the emerging smartphones. So if you can collect at 60 or 100 hertz, it reduces the amount of blur that you get in an image. And we've all seen that when we're recording movies and things on our phones. So if we can record that, we can really actually get quite accurate pose estimation data. Again, if we train it with the right data, and we have a perspective that's consistent. I'll skip over calibration here, but often important as well. So just finishing up here, I haven't talked a lot about wearable sensors, but there was a recent study here just out of University of Alberta, so your neighbor next door. Do wearable fitness devices correlate with performance-based tests? And it was really interesting. So in this particular study, they had participants wear an actigraph. Many of you may be familiar with this. And then they had them complete MMH tasks. And they wanted to know if they could use the actigraph data to predict return to work outcomes. Surprisingly, or maybe not surprisingly, it didn't work well. So it told us that, just knowing kind of a little bit of information about how somebody's moving. So they had one of these sensors on an individual. Just knowing a little bit about how an individual is moving is not probably enough to understand their workability. So again, we continue to explore wearable sensors, computer vision, and the like, to hopefully improve our ability to potentially identify and classify these tasks. Aaron, I just saw you have a question there. I'll jump back to that in a few moments, if you don't mind. So that's a little bit on kind of some of the research we've been doing in the FCE space. Again, nothing that's going to change your practice today, but what I hope is that gives you some things to think about in terms of where the world might be going as we move forward, as enhances in machine learning and technology emerge. Now, I know I'm running a little short on time here, and the PDA piece, is relatively short. But the first question is, it's great we have all these tools and techniques, but are we solving the right problems? So I mentioned with the functional capacity evaluation piece, one of the challenges is that 2 in 5 of us are making determinations based on what we see. And we might be really good at judging what we see, and in some cases, we might not be as good as we think because of unconscious biases or otherwise. So that can be a bit of a problem, but pose estimation solves that problem. In this work here, we looked at novices conducting a physical demands evaluation. And because the PDD, we're not trying to quantify stop points, we're just trying to identify, are they lifting or are they pushing or are they lowering? Well, as you can imagine, that's not hard to do. So we don't have a problem here. We can see tasks. The problem that we have in the PDD is how hard are those tasks? So what I'm showing here is some data that we extracted when we had novices do a PDD. And when they identified lifts and lowers, they had to measure the weight. They had to lift the weight, identify the force of the weight. And here's just one example. The criterion value, so the actual value is 58. The mean of the group, so all of these novices, if we average their data, they thought the load was 78.7 newtons, and the median was 67. The min and max was 1 to 152. So what does this mean? Arguably, we're not great at measuring forces. So when we're doing the PDD piece, we're certainly identifying the right tasks, but setting that threshold of how hard the task is, which is based on the force, we tend to really struggle with that. Again, some of us with more practice, more experience are going to be better than others. So in this case, the problem isn't necessarily seeing, the problem is measuring and understanding the forces. So as we think about this a little bit, and many of you in a workplace setting are probably being approached to, what if we just have folks wear all these IMUs, wear these little trunk sensors, and we can get their trunk flexion and things like that. That's great. But what this particular recent study showed is that's not often enough to predict the effort, to predict the demand in the body. So if we want to be getting better in terms of our PDDs at measuring forces and loads, we can continue practice using our, our force gauges and whatever the like might be, or we can start to get better with smart technologies. So maybe, as this study shows, if I have somebody wear an IMU and I can kind of classify when they're lifting and when they're pushing, I can reasonably guess here, this is the accuracy of an algorithm to predict sort of effort of the task, predict the load in the hands. And we can get close with an IMU. But if we have wearable sensors that are insoles in the shoe, even with one sensor on the trunk and some information about the pressure interface of the foot, we can get a whole lot better. We can add more sensors, we get a little incremental improvement there, but not much. But the take home is, as we have access to these wearable sensors and we're thinking about PDD information, pose estimation, computer vision might not be the solution for PDDs, but wearable tech might actually be a much better solution because we could start to gather information about not just how somebody's moving, but also some of the force interactions that they have as well. Alfred had a good question about suggestions on how to measure forces, efforts for lift in a simple, financially feasible way. Kind of a golden question, other than sort of a typical force transducer, fishhook scale, those types of things. No magic yet. There are some researchers working on some innovative technologies, but I think it's coming. As we think about PDDs, more and more companies are designing their workplace digitally. More and more companies are designing digital twins. As you see in the video on the left here, we have a digital twin of a job. This happens to be a job at Ford. Maybe I don't need to be on the shop floor at all. As we move forward, maybe I can take the digital twin of the job, and as you see on the right, based on the little computer simulation, I can extract out all of my PDD information. I can extract out how far somebody might have to reach, how often they might have to reach. If the forces are coded into the simulation, maybe I can do that too. So again, some really, I think, I'm just kind of showing a little bit of a potpourri today of some of the interesting opportunities and possibilities that are emerging both in the FCE and the PDD space. So I just want to wrap up here, and I apologize, probably went a little bit longer than I had hoped today, but I just want to wrap up with kind of 4 things to think about. So I've showcased, again, a bit of a potpourri of sort of some of the ways that we can embrace emerging technologies in machine learning. There's not a lot of solutions that are fully commercially available yet, but there's lots of movement in our lab and in others around the world to move in this direction. Again, Hinge Health's purchase of Wrench AI as a pose estimator is a good gauge to tell us where the world is going. But how do we stay ahead of this as kinesiologists? So I think 1, try to stay as informed as you can. And I know this isn't easy to do. I have the luxury in my job of being able to carve out time every day to read the latest research, and which I'm trying to summarize for you today to make your job a little easier. But you definitely want to stay up on the literature. But one easy way to do this is find review papers. And one of the, if there was an upside to COVID, it's that a bunch of folks couldn't get into their lab to do research. So they did review papers. So there is a whole emergence of, or an increase in the number of review papers coming out right now, which is wonderful for all of us because it's packing a whole bunch of research into kind of singular places. I know with BCAK, you may have access to some databases for journals. So again, if you can get into those, search for review papers on topics of interest. And it's a great way to sort of keep up to date, keep informed. Also, events like this are wonderful to help kind of keep a gauge on where the world is moving. And it is moving quickly, and our practices will change. I don't know when, I don't know how, but they will. And staying informed will help you stay ahead of that curve, or you'll be ready when it's your clinic that gets to that update. Words of kind of advice: really think about your data management practices. Some clinics do a fantastic job of this. Some practitioners do a fantastic job of this. Others, it's a little bit more secondarily. You really want to kind of think about, how do you manage your data? Do you store it in an electronic record? Do you store it in a spreadsheet? Are you pencil and paper? Who has access to that spreadsheet? Are spreadsheets including, I have one spreadsheet for client A, one for client B, or do I keep aggregate data across? These can all be really helpful. And the reason this is so important is there are more and more tools that are making machine learning accessible for you and I without any computer science training. But what's going to matter and what's going to allow you to really leverage these is that you have data that you understand, that's organized, that's clean, and you know kind of where to find it. If you have that in place, as these machine learning tools emerge, you're going to have the ability to use your own data and learn from that in your own way, without having to have a whole lot of elaborate training. So thinking about the data that you have, one of the questions I always ask, do you ask your clients if their data can be used for research purposes? Do you have them consent to use data for secondary analyses? If you don't, it's certainly worth doing, and not because you're going to farm it out to somebody like me, but because you might actually want to do your own internal research, or you might want to work and compile de-identified data across a number of KINs and explore some of these as well. Proof tip number 3, I'm a big fan of upskilling. Given the rate of technology advancement today, it's really important, I think, to upskill. I just recently completed an MIT course. Doesn't make me any smarter than anybody else, but the reason I chose the MIT course is because it's open courseware. So MIT has a number of wonderful courses that you can take completely for free. I've just hijacked one here, Machine Learning for Healthcare. Again, you don't have to be a computer science major to do these. The tools that you've learned in an undergraduate kinesiology degree are probably sufficient to get you started to be able to follow along. Spend a couple hours here and there over a couple weeks, and suddenly you're going to have some tools in your toolbox, along with all of the data that you're aggregating from your clients and team, along with a good data management plan. You're going to be able to leverage some of these tools on your own to enhance your practice, to enhance the value that you can provide for your clients. And events like this through the BCAK, again, wonderful opportunities to upskill and become aware of new technologies as they're happening. And my 4th kind of future proof tip, please ask lots of questions. I'm always a big fan of asking questions, but now more than ever. I'm sure that all of us are being pitched. It feels like almost daily on new technologies, the new this, new that, new whatever it is. Ask questions. Now more than ever, it's really important to separate fact from fiction. And within the kinesiology practice, within functional capacity evaluation, within PDDs, within workplace monitoring, workload management, those types of things, it's really important to ask questions like, what problem specifically does the technology or algorithm solve? Do I, as a clinic, do I actually have that problem? So again, I spoke about FCEs, and 2 in 5 kinesiologists are just kind of eyeballing to say when somebody is safe or unsafe. And that's probably good most of the time, but when it's not, it's a problem. So do we have tech that can help us address that problem? And yes, we're moving in that direction. On the PDD side, do I have a problem with knowing how people are moving? No, I can identify pretty easily a lift from a push or pull. What I have trouble with is figuring out how hard they're working. Does the tech solve that problem, for example? And if it's just a wearable, trunk inclination monitor, that's not telling me how hard they're working. I still don't know what the force interactions are. So that might not be enough. It might not be solving my problem. Really important to know what the tech is measuring as well. Are we measuring just a trunk angle? How important is that? It's useful. It's a piece of information. Is it enough information to actually make a decision? I don't know. It depends on the case. So again, thinking about these is really important. Alfred just notes that when eyeballing a problem, the challenge is how much effort the movement is, how much capacity they have. Exactly. So it depends, what you're trying to learn and what the technology can do. One really good test that I've always found, anytime that an individual is being pitching tech to me, I ask them, can you explain it in the simplest terms possible? Like you were explaining it to your grandmother, grandfather, 5-year-old, whatever it is. Can you explain it at that level? And if you can't, I'm not interested. Now, maybe that's a hard line, but again, there's so much technology and things are moving so fast. I want to trust the technology that I know is solving a problem, and I know that can be communicated to me in a clear way. And hopefully today we've demystified a little bit of what we mean by AI and machine learning and computer vision, so that you can start to understand how some of these technologies might be working. I've talked a little bit at a high level about some of the pattern recognition tools that we were using and how we can kind of classify and identify. But ultimately, is the technology identifying? Is it classifying? Is it predicting? If it is predicting, how did it learn to predict that? What was it trained on? How did it learn to make that decision? So those are some questions that I want to share with you that you can kind of think about as you're moving forward. I noticed a question from Matthew. Are there any apps, software that you would recommend? Again, not right now. There's nothing that sort of stands out as being a front runner. There's a lot of emerging technologies that are really promising. And what I'd suggest, Matthew, to you is, as much as you might not like this answer, do a little bit of upskilling and then a little bit of research on these technologies and, identify the ones that are working to solve the types of problems that you're seeing in your practice. But there's many, I think, moving forward. So with that, apologize, I ran a couple minutes late here. Thank you very much for taking some time to listen today and to give me an opportunity to share some of the work we're doing. And I hope, if nothing else, you've taken away a little bit more awareness and understanding for how the field of artificial intelligence and wearable technologies might be shaping our practices as we move forward, and how you can prepare to future-proof yourself to be able to move along with these changes in a very productive way to enhance your practice. So thank you very much. Happy to take any questions that are still out there.
We do have to wrap up because we've run a little late, but I did wanted to circle back and make sure Aaron's question from earlier was answered.
Oh, right. So how much does compressive and shear lumbar force increase when participants demonstrate increased outliers from normally classified lifts? Great question, Aaron. Full disclosure, I've worked very closely with Aaron over the last few years. Aaron, we can certainly chat about this offline, but in this particular study, we did not, in the fatigue study, we didn't look at spine compression and shear. We just looked at kinematics and how the kinematic pattern changed as somebody continued to lift over time and reported an increase in their rating of perceived exertion.
Okay, I believe that's everything. All the questions have been answered from what I see in the chat. Again, this recording will be made available to everyone within the week, audio, visual, and we'll go through the chat to see if we've missed anything. Thank you to Stephen for your presentation, and for thank you to everyone who's attended and participated.
Great. Again, thanks so much for the opportunity. And for anybody that's attended the talk, please don't hesitate to reach out, send me an email. Love to chat about what you're doing, love to chat a little bit more about this, and happy to continue the conversation offline.